paske li ok pou pa ok. Paske pale kapab ran bagay yo miyo. Paske eseye komunike se un sin fos. Toujou gon rezon pou pataje ki jan ou santi yo. Paske santé mentale ou konte.
Welcome, everyone. Hi, Dr. Ojikutu. Thank you
Hi,
for
how are you?
good. Thank you for joining us. Thank you all for watching. For those of you who are not familiar with our guests, we have Dr. Ojikutu, who is the Executive Director of the Boston Public Health Commission, joining us for an amazing conversation today about the different things that are going on in the city when we talk about racism as a public health crisis. We'll also go into some conversations about the mass health reinstatement. So lots to learn, lots to understand, lots to gather, and a lot to share. So we welcome you and thank you for being here. My name is Brenda Lormil. I am the founder of the Haitian American Medical Association. I also practice at Mass General Hospital in the oncology department, phase 1 research. I am so honored to be here, to be chatting with Dr. Ojikutu. So I will not waste any time because I know there's a lot that we want to cover, but I want to jump into the conversation by having a basic definition. So we've heard the word or the term per se, racism, right? Structural racism. Can you just define that in the most basic way for us to really just dive into the conversation and get context?
Sure, and thank you so much for having me. You're right. A lot of people are using the term structural racism, and unfortunately, it oftentimes doesn't come along with a definition, and it's sometimes confused with other forms of racism, which I will also mention. Structural racism itself is really about systems. So systems in which policies and institutions create and then perpetuate racial inequity, socially, economically, and politically, and oftentimes this leads to poor health outcomes. When I say systems, I'm talking about the context of the world that we live in. It's not about what happens within an individual medical institution or within an individual academic institution. It's really about all the institutions. It's really about our entire system. And another way that I tend to explain structural racism, it's really about a system of hierarchy, privilege, and power that excludes non-white individuals and then perpetuates racial inequity. I hope that is clear.
No, that is very clear, and it's actually segueing into my next question. Is you use the word systems, right? So we talk about structural racism is a system. Can you give an example of how structural racism as a system can affect the health outcomes of an individual and even a community based off of the work that you do at the Boston Public Health Commission?
Well, I think there are a number of really profound examples that have been within our system for centuries almost. So if you think about housing, and housing both nationally and housing both locally here in Boston, we know that the U.S. has a history of racially biased housing policy. An example of that is redlining, and I'll define redlining. So it's another word that oftentimes is thrown around and then not really well defined. So redlining was a system of ranking neighborhoods by their worthiness for home ownership. So whether or not homes were increasing in value or decreasing in value. And essentially, the neighborhoods where Black people live were often deemed less valuable and less worthy for home ownership, and therefore mortgages were not given out. All right, so they were impossible for Black people, many Black people, to obtain. And without home ownership over decades, there's been a significant loss of generational wealth within communities of color, and that has led, in many circumstances, this issue of this history and policy of redlining to residential segregation. So, and you look across the city of Boston, you see that there are areas where primarily Black and brown people live, And then you have areas where primarily white and wealthier individuals live. And what happens within those neighborhoods where you have these sort of lower rates of home ownership, lower values in terms of the homes or the properties that are there, oftentimes those neighborhoods are under-resourced in general. So under-resourced in regards to healthcare services, under-resourced in terms of other services that may be provided. And if you look just at our housing, sort of challenges here in Boston, the quality and affordability of housing within neighborhoods across Boston is a challenge. So that's one example and one way to look at it. But we could also talk about discriminatory immigration policies. We could also talk about mass incarceration. We could talk about employment. It's really throughout all of the systems that we see across our city and across our country and beyond.
I love that answer, because we may look at housing as an issue, but then when we think about health, the health of an individual, if I can't secure a safe place to stay, how does that then affect my overall health and the health of my family, right?
Exactly.
I love it, because as a clinician, we look at these things, right? The person who's coming into the institution, we're caring for them within the four walls of the institution, but what happens outside of our four walls is actually what's determining how well their health outcomes are when we're caring for them. So I love the housing example, and thank you for using that as an example. As we use that and segue into health inequities, that's leading up to my next question. Before we get into my next question, can you define what health inequities are?
So generally, health equity is when everybody has a chance to live their best life, right? So that everybody has access to resources, everybody has a full a full life expectancy, or at least somewhat similar life expectancy across race and ethnicity. When you're talking about racial inequities, you're really talking about differences across people. You're talking about looking at a situation where amongst Black individuals, and I'll just give you some updated data. If you look from 2017 to 2021, Black residents in Boston experienced a 37% increase in premature mortality. That's across that time span. But there were no significant changes in the rate of premature mortality amongst Asian, Latinx, or white residents during that time period. So there's a clear inequity in regards to mortality and in regards to life expectancy. If you look at life expectancy in Boston, we know that the average life expectancy across all residents is approximately 81. But let's compare that to the life expectancy amongst Black males, which is actually more around 71. So these are the data that we know they exist, and they demonstrate pervasive inequities across our system.
And with that data that you guys have, and data doesn't lie, right? What are you guys at the Boston Health Commission, how are you combating some of these issues that you guys are seeing, some of these things that we probably have known for some time, but then there are other things that always pop up, right? How are you guys combating the health inequities that you're discovering in the city of Boston?
Well, I think that one of the ways that public health works in general is that we spend a lot of time, aggregating data, which is kind of what I tried to, give you just a snapshot of or a snippet of. And then we look at the programs that are offered. We look at the strategies that we're going to implement. And we attempt to sort of match the problems that we see in the data to whatever programs and interventions that we're hoping to implement. So, for example, within the COVID-19 response, we know that there was inequitable access across our city in regards to testing, in regards to vaccination, especially early on, right? So what we did is we prioritized equity in our response, and we removed barriers to accessing all of those things, accessing testing, accessing vaccination, accessing treatment. And currently we have standing sites for vaccinations and boosters in the areas where we saw those inequities. So we have a standing site in Dorchester, we have one in Nubian Square, Roxbury, we have one in Hyde Park, and we have them in more general locations, because of course we want to make sure that all residents have access. So that's one example, but there are numerous. So
Right.
we're all aware, during COVID-19 and after COVID-19, sort of what we're currently experiencing now in terms of sort of post the surges that we've had and the lockdown, mental health has been a major concern for people. And one of the things that we know has been a challenge is there's certainly stigma in regards to accessing care and treatment in regards to mental health. But then we also have a lack of mental health providers within our communities, both mental health providers that look like us, as well as those who are linguistically competent and able to, communicate with a diverse patient population. So one of the things that we've invested in here at the Boston Public Health Commission is a new Center for Behavioral Health and Wellness, where we are in the process of training a whole slew of healthcare providers who will be prepared and able to provide services to individuals coming from diverse backgrounds. So again, we look at the problem and then we try to find equitable solutions.
And the solutions are ongoing, right? Just
Yeah,
hearing,
absolutely.
right, they're ongoing. Some of us might feel like we're out of COVID, which is not true, right?
Right.
But the vans are still there, the sites are still there, the people are still there, the mobilization is still happening to meet the needs of the community. I know we're not at the end, but I want to take some time to just say thank you for all the work that you guys are doing around, how to support people through COVID and these post-COVID times. So, we talk about healthcare access to it, but there's something that's happening in April that's coming up, and April's in just a few days, the mass health redetermination, right?
Yes.
So we can find hospitals and clinics, but if we don't have health insurance, which is a mandate in the state of Massachusetts, how do we support our communities? But if we do have insurance, how do we keep it? Can you explain the mass health redetermination process so our viewers have a better understanding?
So this is incredibly important, and it's important that even if you're hearing this and you don't have mass health, that you spread the word. Essentially, mass health needs to renew coverage for all members, essentially determine eligibility on an annual basis. And that has just been a standard in terms of sort of the policies in relationship to mass health. During this period of redetermination, people who have mass health need to update their information so they can maintain their benefits. If they don't, then they will no longer have access. So this is sort of, again, just a standard part of mass health as an insurance source. During COVID, redetermination, so this checking to see if people are eligible, was temporarily paused. And that was important because so many people, either didn't have there was, obviously we were in a lockdown, people didn't have access. There were many issues that were ongoing, and certainly people weren't necessarily accessing our community health centers or other service areas where they may even get assistance in regards to redetermination. So this year, we will no longer have that freedom to not redetermine eligibility. So what will happen is that people will need to go through the process again. And think about it. If you haven't been doing something for 3 years and now all of a sudden you have to do it, you may not be as familiar with it anymore. You may ignore the notices that come in the mail. It may not be something that's at the top of your mind. And what we anticipate may happen is that a lot of people will lose coverage and then not have access to necessary health services. This is something we are really trying to avoid. We want to make sure that if people they have mass health, if they have received a notification in the mail, that they open it, and if it's not clear to them, that they reach out for help. And that's one of the things that we're doing here at the Boston Public Health Commission. It's something we do continuously. This is one of our longstanding services. We provide what's called the Mayor's Health Line. And we have people who are manning telephones, and they are specialists in mass health and in coverage and in making sure that people are linked to care. For all those individuals who either miss the envelope, the blue envelope that I mentioned, or if they have questions, or if they need to have somebody help them interpret the information that's in the blue envelope, this is where they should call. They should call 617-534-5050, Monday through Friday, 9 to 5. We have people who speak more than 5 languages. It's free, it's confidential, it has nothing to do with immigration status. No one's going to ask you those questions. It's simply there to provide you with assistance. So please avail yourself of that service. Please utilize it and spread the word.
Thank you. And for the process itself, is there a cutoff in terms, I know it starts in April, but is there a particular time frame that folks should be, reaching out if they need help by a specific date?
So once you get the blue envelope, that's when you need to be reaching out. Okay. This is going to be a long-term process over the course of a year. I do not know. There's going to be a due date that's on the renewal package. You will see that you will see that due date. And that is what you need to pay most attention to. And when you call the Mayor's Helpline, which is the number I gave you, 617-534-5050, they will help you figure out exactly what your sort of your time period is. If they're, and they'll help you address anything that has caused a problem. And if you've already tried to renew or had your eligibility redetermined, they will assist you with that process.
One thing that comes to the forefront of my mind is that in the past 3 years, so this hasn't been a process because of COVID, of course, but a lot of people may have moved and they might not even receive that blue envelope. So if you hear the number that Dr. Ojikutu just mentioned, and it'll most likely be at the bottom of the screen, don't hesitate to call that number, because if you've moved and the address that they have on file currently is not where you're living, you want to make sure that you're reaching out and updating that information as soon as possible, because your due date is on that envelope, and if you don't receive it, then you have a due date of today, right? That you want to call. You want to call and get that underway. Are there any other community organizations that are helping folks? I know there's HICFA, Healthcare for All.
I was going to say.
Mayan Budsman. Is there anyone else that folks who might be more comfortable to reach out to other community organizations that you can think of?
So many people have started going back to their healthcare providers, and our community health center partners. We have wonderful community health centers in the city of Boston. They are offering similar services. Boston Medical Center is offering similar services. MGH and Brigham and Women's Hospital, they're all trying to help. We try to augment that because the issue is that some people are not accessing health services than they need to, right? So we're trying to sort of fill in the gaps of all of the wonderful work that's going on in terms of what our healthcare partners are doing. And certainly Healthcare for All, as you've mentioned, is a wonderful organization that's doing an enormous amount of work.
Yeah, I will say for our Haitian community, we're working on getting that information in the Haitian Creole language over a live stream, so that will be available for folks to understand. And I love it that you had mentioned when they do call in, there are folks who speak different languages who can assist. Sometimes folks do not engage because they're afraid of that linguistic barrier. So if you're listening to this, share the information with your loved ones, with your community. Know that there is help. We do not want you to have a lapse in your insurance, because that is also your key to accessing care as well. Dr. Ojikutu, any closing remarks? I know we're coming right up to time, and I just want to thank you for sharing everything. Anything you want to share with folks who are listening?
Well, I think one of the things I want to share is that we at the Boston Public Health Commission are a resource. And there are many programs that we have out there, but if there are things that you think that we are, not doing, or things that you would like to see happen, then reach out. Let us know. Send an email. We have an info line. We have, people who are out in the street. You'll see us, at different events. We want to be here to serve. Our goal, our mission is to, meet the needs of Boston residents. And that's what we're here to do. We have a lot of programs that I think oftentimes people are not aware of. We are going to try to do a better job of letting people know the services that we provide. I think that's one of my goals since I've started in this position. And so maybe you'll see more of us out in the community also.
Well, I have to say thank you for all the work that you guys have done. And thank you for the work that is to come. And thank you also for your time this morning.
Thank you. I really appreciate it and look forward to potentially talking again.
Awesome. Thank you.
Take care.
Paske li oke pou pa oke. Paske pale kapab ran bagay yo miyo. Paske essayez communiquer, c'est un signe force. Tout toujou gon rezon pou pataje ki jan ou santi yo. Paske, santé mentale ou konte.